Your skin instructor's tip of the week. One of the biggest mistakes that estheticians make when treating acne is focusing only on what they see today instead of what the skin might look like 6 months from now. Every inflammatory lesion has the potential to leave behind a reminder. Sometimes that's temporary redness, sometimes it's pigmentation, and sometimes it's permanent textural change. The goal isn't just to clear acne. The goal is to prevent the damage that acne can leave behind. The earlier we intervene appropriately, the better the long-term outcome for our clients.
Welcome back to the Skin Instructors. I'm Jolie.
And I'm Morgan, and today we're wrapping up our month-long breakdown of acne for Acne Awareness Month. Today we're going to dive into a topic that affects so many acne clients long after their breakouts have resolved: acne scarring.
And honestly, this can be one of the most emotional parts of acne treatment. We can clear active breakouts, but for many clients, the scars are what continue to impact their confidence every time that they look into the mirror.
Exactly. We hear clients say things like, my acne's finally gone, but my skin still looks unhealthy. Often what they're seeing isn't active acne anymore, it's the aftermath.
So today's episode is going to help you understand the difference between true scars and post-acne marks, why some clients scar while others don't, treatment options available today, and how we can help clients set realistic expectations throughout the process.
Yeah, because when it comes to acne scarring, knowledge and timing can really make a difference. So before we even talk about scar treatments, we need to talk about prevention. One of the biggest predictors of acne scarring is inflammation in the skin. The more intense the inflammatory response, the greater the potential for tissue damage. So think about what happens during a severe inflammatory breakout. The body's going to send inflammatory mediators into the area to fight what is perceived as a threat. And that process unfortunately damages your collagen, your elastin, and the surrounding tissue structures.
And that's why a client with a few occasional blackheads typically isn't our biggest scarring concern. The clients we're watching closely are the ones experiencing those deep papules, pustules, nodules, and cystic lesions. Those lesions reach deeper into the skin and create a much greater risk for permanent structural damage.
Right, and that's why waiting 6 months to see what happens with severe acne can be really problematic. Every inflammatory lesion is another opportunity for tissue destruction, and the sooner we can reduce inflammation in the skin, the better chance we have to preserve healthy skin structure.
This is also where client education becomes so important. Picking, squeezing, digging, and over manipulating lesions dramatically increases inflammation and trauma. Many clients create more scarring from picking than the acne itself would have caused. One thing I wish more estheticians understood is that not every mark left after acne is actually a scar. Clients often use the word scar to describe anything that remains after a breakout.
Yeah, that's a great point. We generally are going to see 3 different categories. So the first one being post-inflammatory erythema, or PIE. And those are your pink, red, or purple marks commonly left behind after inflammatory acne. They're caused by vascular changes and lingering inflammation. And then the second one is going to be your post-inflammatory hyperpigmentation, or PIH, commonly referred to as. And those are your browns, tans, or gray discolorations in the skin. Those are caused by excess pigment production following inflammation. And then lastly, we have true acne scars, which are going to involve actual structural changes within the skin.
This distinction matters because the treatment approach is completely different. A client with PIE may benefit from calming inflammation, vascular targeting treatments, and time. A client with PIH may need pigment management strategies. And then a client with true scarring requires collagen remodeling and tissue reconstruction.
Yeah, and that's why proper assessment is going to be so important, because if we misidentify the problem, we're likely going to recommend the wrong solution. So most people, when they think about acne scars, they're thinking about what's referred to as atrophic scars. Atrophic scars are depressions in the skin that's caused by collagen loss.
These scars form when the body doesn't produce enough collagen during the healing process. So instead of the skin healing flush and smooth, it heals with like a depression or an indentation. And there are three primary types.
The first one being ice pick scars. They are narrow, deep scars that look like someone punctured the skin with a sharp instrument. And they're often the most difficult type of acne scar to treat because they extend really deep into the dermis.
Then we have boxcar scars, which are wider depression with more defined edges. They often appear as round or oval indentations and can vary in depth. Those tend to respond better to many resurfacing treatments than ice pick scars.
And then lastly, rolling scars create a wave-like appearance across the skin. So instead of having sharp borders, they create broad depressions. They make the skin surface look uneven or undulating. These often result from fibrous bands pulling the skin downward beneath the surface.
Many clients have a combination of all three types, which means treatment plans often need multiple approaches. While atrophic scars are more common, we also need to recognize hypertrophic scars and keloids. These occur when the body produces too much collagen during healing.
Yeah, so instead of creating a depression, the skin is going to raise up and form a raised scar. Hypertrophic scars remain within the boundaries of the original injury, while a keloid is going to actually extend beyond the original injury and continue growing into surrounding tissue.
These scars are more commonly seen on the chest, shoulders, jawline, neck, and back, and they're also more common in certain genetic populations.
This is where referral becomes really important because aggressive collagen stimulating treatments may not always be appropriate. Medical management is often necessary with hypertrophic or keloid scarring. Personally, I struggled with both hypertrophic and keloid scars on my shoulders. And I would get like steroid injections from my dermatologist. I also did a special laser to help remove the pigment and to flatten. I saw some improvement there. And then finally, once I got flat enough, my dermatologist gave me permission to just get them tattooed. And so now I have a beautiful collection of flowers on my scars. And honestly, it's like boosted my confidence so much.
Yeah, I just realized actually you don't see them at all anymore.
Not at all.
The tattoo.
No.
And the tattoo's gorgeous.
Thank you.
Yeah.
So one of the most powerful things that we can do for our clients is to intervene before scars become established. The best scar treatment is preventing the scar from forming in the first place.
We sometimes get so focused on clearing active acne that we forget every month of uncontrolled inflammation increases the risk of permanent damage. If a client has moderate to severe inflammatory acne, this may be the time to discuss collaboration with a dermatologist or a medical provider.
Yeah, the sooner we control inflammation, the better the long-term cosmetic outcome. This isn't about being aggressive for the sake of being aggressive. It's really about preventing years of emotional and financial investment in scar revision later. I really wish that I had gotten ahead of my acne scarring because not only like the situation with my shoulders, like that caused so much emotional baggage, honestly. Plus I had to pay for the laser and the steroid injections and the tattoo. Like it costs a lot of money, but on my face, if I added up all of the treatments that I have done to help with my acne scarring, I mean, tens of thousands of dollars. It's wild. I just like, I wish somebody had been in my corner to help me. Yeah.
No, I completely agree. I can definitely understand that. Well, let's talk about treatment options because this is where estheticians can make a tremendous impact. Microneedling is one of the most commonly utilized treatments for atrophic acne scars because it stimulates collagen remodeling and wound healing pathways.
I think we're the perfect people to be talking about this because both of us have gotten all of the things done.
We sure have.
Specifically about microneedling, repeated treatments can gradually improve texture. It's not a one and done.
No.
Period. Like, I don't care what microneedling you get done. It's not a one and done if you have acne scars, unfortunately.
No, it's not.
It will, however, improve the texture and soften the scar borders. So maybe you have more of a boxcar scar. It could make it look more like a rolling scar. It really can soften the edges. Microneedling can improve your skin quality. So when your skin is healthier, it's going to boost collagen production and start to repair those areas. But clients, you have to set very realistic expectations. We're talking months, if not years, depending on how bad the acne scarring is.
Yeah.
It's not a one and done.
No, absolutely not. I've had a couple of boxcar scars on my face, and between microneedling and what we're going to talk about next is chemical peels, it's really helped to kind of make those into more of a rolling scar now.
Yeah.
Which has been super helpful. But I mean, I've had tons and tons of these treatments now.
Yeah.
So
Yeah.
on that note, chemical peels can be incredibly valuable. While they're often associated with like pigmentation correction, appropriate peeling protocols can support collagen stimulation and skin renewal.
I'm so excited to get into this topic.
I know, me too.
We have been gatekeeping for the last month.
Yeah.
At the end of May, we went to a 2-day training in Los Angeles with VI Peel, and it's by far our all-time favorite chemical peel on the market.
Absolutely.
So I'm excited to tease this subject, but stay tuned in July because we're gonna tell you all the things. I promise we are not gonna gatekeep any
Absolutely.
longer. But yeah, so chemical peel, actually we are actively peeling because
Yes.
we recorded this episode on June 1st.
Yeah.
And we just got back. And so we're actively peeling. And as much as I have said I don't love the peeling process, honestly, Jolie, this really hasn't been bad.
It's not, especially when you're consistent with your skincare routine.
I know. And I have been.
Yes, I know you have. And you're consistent with treatments. The peeling process is not nearly as bad.
No, it's not bad.
It's not that sheet peeling. It's just more of flaking, some sloughing off,
Yeah.
nothing crazy. And it's so much more tolerable.
Yeah. So stay tuned for my journey. I'm saying it right now. I'm doing a series this summer. I know that sounds crazy because we don't usually talk about peeling in the summer, but I'm doing it. I'm doing it.
I'm so excited.
So anyway, moving on. All right, laser treatments. This for sure can be a game changer for the right client. There's tons of different lasers out there, but I would say for acne scarring, if you want results, you need a fractional resurfacing laser. Other advanced technologies, they can significantly improve those scars, but you got to make sure that you are the proper candidate and make sure you plan for your healing time there.
Yeah. The important takeaway is that no single treatment works for every scar type, and treatment plans should be individualized based on scar morphology, skin type, lifestyle, goals, and budget. And oftentimes a treatment plan including multiple of these modalities, it's what's going to be best for the client.
Agreed.
You're targeting different layers of the skin, you're targeting different processes within the skin, and they're just going to get better results.
Agreed. Yeah, layer it. So have a client come in, do a chemical peel, 4 weeks later, get your microneedling done, go back to the chemical peels, or layer in some lasers.
Yeah.
When we start talking about home care, which is next, you're going to laugh so hard at what I'm doing, but you're going to laugh because everything I'm doing sounds like it's the same product, but they're different product lines.
Yep.
They're working in the skin in different different ways.
Yep.
So while they all say, oh, this is for collagen production, this is for collagen production, it's okay to use multiple products that address the same concern if they're working in different ways, different mechanisms.
Yeah.
Yeah.
Different ingredients are used, different formulations are used in them. So I love that.
Yeah.
I think it's perfect.
So now let's talk about that home care. So speaking of scar revision, clients have to know what they're doing in between these appointments because it really matters. It matters a lot.
Absolutely. Daily sunscreen is a non-negotiable.
Definitely.
Always. UV exposure can worsen pigmentation. It can prolong the healing, and it can interfere with the treatment outcomes.
It's contributing to cell death.
Yeah, absolutely.
So how about we just wear sunscreen, guys?
Let's do it.
Beyond SPF, ingredients that support collagen production, cellular turnover, and just general overall skin health can be incredibly beneficial. So think retinoids, growth factors, peptides, vitamin C, carefully selected exfoliating ingredients. They all have a place depending on the client. Now, I told you I was going to share what I've been doing.
It's insane.
Julie already knows.
I love it.
It's nuts. So we love ZO, Skin Better SkinCeuticals.
Yeah.
All three of those brands have products that build collagen, that help with lines and wrinkles, tighten firm, improve
Contour.
laxivity. No, laxity. Thank you.
Elasticity, yeah.
I was trying to
laxity.
combine both of those words. Okay, laxity and elasticity. So I basically have been using all of them. So let's start with Zio. Peptide concentrate. She's my fave. The neck cream.
I love it.
The growth factor.
One of my favorite products.
I know, it's so good. SkinCeuticals, I've got.
And firming serum.
Oh, shit. It's going to keep going. Firming serum. I'm forgetting. I need a list. SkinCeuticals, I have PTX cream, AGE Ultra Serum. What else am I doing?
Are you using AGE cream too?
I have it.
Okay.
But I have not put that back into the routine.
Okay.
I've got a lot of creams going on. And then Skin Better, I've got Maestro Revive, Ampra, Face and Neck. Guys, it's bad. It's actually kind of crazy, but honestly, I love my skin right now.
I mean, your skin's been looking really good.
Thanks, friend.
Been so smooth and glowy. And I think like how we mentioned earlier, yes, it is a lot of like collagen or firming or laxity, products, but they're all working in different ways.
Yeah.
They're all different technologies and they're all different ingredients that are being used to do that. So like for instance, firming serum from ZO is specifically helping to strengthen that DEJ, whereas, peptide concentrates helping more with the lifting and the contour and things like that. So they're all doing something different, which is fun.
Exactly.
Yeah.
Yeah. I mean, I just want my acne scars to go away, guys.
Yeah.
And not to look 40 years old.
You don't look 40 years old.
I don't think I do.
Not at all. No.
I am 40, guys. Anyway, moving on.
But remember, more isn't always better.
It's really not. It's overkill sometimes.
Sometimes, yeah. But like over exfoliating, over treating, and chasing quick results will often lead to like irritation, inflammation, and just setbacks in general. So the goal with this is consistency, which is something I talked to Morgan about.
And I've been very consistent. And I know this is why I'm seeing changes in my skin. And I love it.
And this is why you've been peeling so much less too, compared to like VI peels you've done in the past.
Yeah, I've preached this for years that you have to make your skincare routine like a ritual and like part of your self-care. And I know you've got that down. That's your thing.
I can't go a night without doing it. Yeah.
I am not a practice what I preach kind of gal. And so I started doing that. And I'm like, wow, this is why people do this. This is why I tell people to do this.
Yeah.
So yeah. Anyway.
Yay. And then I think one of the most important conversations that we can have is that acne scarring isn't just like a cosmetic concern. For many clients, it's tied directly to their confidence, self-esteem, social interactions, and mental health.
I am that client. For clients who are in this space, we carry that emotional wound of acne for years after your skin is clear. My skin has been cleared for 15 plus years. And this is going to sound a little crazy. I'd rather have breakouts than my acne scarring right now. Like it's a terrible thing to go through. Your client might avoid photos, or they might wear heavy makeup to cover everything up. They could even decline social events. I know for me, my clothing choices were impacted. Like I wouldn't buy certain dresses if it showed like my shoulders. It's tough.
Yeah, I mean, on that topic of that is like, I'm at a place where I'm so tired of it. To the point where when we were at our training the other day and we're talking to the trainer, I was having something going on. I think it was like a little fungal acne, whatever going on. Like I wanted to, in my head, burst out in tears.
You wanted to run.
Yeah. I'm so tired of talking about it. I'm so tired of it being my main concern.
Yeah.
And I was tired of dealing with it, like honestly.
Yeah.
And so it's just such an emotional thing. And I agree with like the not wanting to go out sometimes or like taking photos. Like I hate when I can see it in the photos. And it's just like a hard thing for these clients to go through. Everyone's looking at your face. That's the first thing people notice. And so when you have that acne, it's so hard to feel confident and feel good in it. With it. So that's why the empathy really matters here. We need to remember that we're not just treating that issue, but we're helping someone rebuild their confidence.
Absolutely. And I think that's why most estheticians have gotten into this industry.
Totally.
I think one of the most impactful things that we can do is provide realistic hope, not false promises or miracle claims. Just give them a clear plan with realistic expectations and support them through that journey.
So your homework this week is to spend time studying some acne scar morphology. Pull up clinical images and challenge yourself to identify whether you're looking at post-inflammatory erythema, post-inflammatory hyperpigmentation, ice pick scars, boxcar scars, rolling scars, or hypertrophic scarring.
Yeah, the better you become at identifying what you're actually seeing, the better your treatment planning can become. And remember, the correct diagnosis always comes before the correct treatment.
Thank you for spending time with us today on The Skinstructors.
If you enjoyed this episode, please take a moment to rate, review, and subscribe wherever you're listening.
You can also follow us on Instagram at SDTraining and visit us online at www.sdtraining.com.
And if you're looking for even more educational content, be sure to check out the Skinstructors Extra Credit membership, where we share additional resources, guides, and advanced learning opportunities for aesthetic professionals.
Until next time,
don't hesitate to educate.